Well, good afternoon, everyone. Welcome back to the Prince George's County Memorial Library System's virtual programs and online library. We are now in month 10, 12, 14, 20 of COVID land, and we've got our great community conversation series that's continuing Thursdays at 4. Roberta Phillips, our CEO, our typical guest, is not with us today. She had another commitment that she had to make it to, so we are very pleased to introduce one of our wonderful colleagues here at the library, Aishar Pinnock, who is our Director of Talent and Culture, which you might know as human resources in other places, but her purview is a bit different than the typical human resources director in that there's a lot of staff development and leadership training involved in her portfolio. So today's program is very important because we're going to be talking about healthcare and accessing it, and also some of the different ways that folks can get into healthcare if they don't necessarily meet the criteria for the typical open enrollment period. So we have very special guests from Prince George's County Health Connect, Sherry Curtis, who was with us back in the summer, and also Ben Fulgencio-Turner. And we're very excited for this conversation. We hope you all enjoy. Let us know in the chat if you have questions. There's going to be plenty of opportunity to learn here today. And we do encourage everyone to ask questions, even if it's a question for a friend or an answer that you just are curious about for the community at large. We'd love to hear from you. Without further ado, we'll turn it over to Aishar. Thank you.
Good afternoon, Nick. Good afternoon, everyone. And Nick, thanks for that introduction. So we could just kind of jump right in. As he mentioned, we're talking about health coverage in Prince George's County. And let's talk about that access and reaching the uninsured. So I'm going to just get started with the basic question. What is Prince George's Health Connect?
So Prince George's County Health Connect is the connector entity, one of 8 in the state. And we are all under the umbrella of Maryland Health Connection. So in Prince George's County, our connector program has a number of community partners that help us with education, outreach, and enrollment services. And I'd just like to give a shout out to our partners, if you don't mind, because they really are the engine behind what we do. There's HCDI International that's been with us since the beginning of our program. They host navigators, and they also operate our storefront locations when we are actually seeing the community. We have 2 storefront locations that are outside of government offices and give the community an opportunity to go to a location that is not government structured and see navigators and even brokers, insurance brokers at those locations. Our other important partner that we've been working with since the beginning is Mary Center. Mary Center is one of the large FQHCs, but they also provide a lot of education and health services throughout the region. And they're a strong partner, and they work with us inside of our DSS offices to serve the community. Right now, of course, we're all remote. Mm-hmm. We also have SEED, Sewing Empowerment and Economic Development. They're a small nonprofit over in Riverdale. Casa de Maryland is a huge partner for us, particularly in helping us with people that have limited English proficiency, and they work really hard with the immigrant population, and they have an amazing health hotline where they take calls for us, and they also help us with enrollment. Ben works for the Primary Care Coalition of Montgomery County, and they've been with us from the beginning, helping us with program measures and educational materials and outreach and reports on the data and how well we're doing. We also have Prince George's Healthcare Alliance, which is a nonprofit organization that has community health workers that help bridge the gap between residents who need access to primary care. And they work really, really hard in terms of working with hospitals and providers and members of the community. And they're a really good resource for us because they get a lot of referrals for people who don't have health insurance, and they have community health workers right there on site that can assist with that enrollment opportunity. And Community Clinics, Inc. is another partner of ours, and that's another FQHC in the area. So as you can see, we have not only an opportunity to work across the entire county, but we work very close with our health centers and clinics and hospital partners to make sure that they let us know when people need to have health coverage. They send them to us, and we get them hooked up. Prince George's County Health Connect's motto or slogan is get covered, get seen, get healthy. And I think if you look at that trajectory, you understand why it's not only important for us to get people enrolled in health coverage, but we want them to actually use and maintain the health coverage and work on reaching their maximum level of health. So it's really important that we continuously promote the importance of having health coverage, and nobody needs to understand that more than right now of what we're going through. And so that's Prince George's County Health Connect. We are working remotely, and you can reach us by phone, and we have navigators, serving the entire county every day and during open enrollment, even on Saturdays.
Oh, wonderful.
So I'll stop there.
Wonderful. Great outreach and great opportunities to work across the board. So can you tell me, now that we talked about Prince George's Health Connect, what the Maryland Health Benefit Exchange is, and what is healthcare.gov? And how do they compare?
Maryland Health Benefit Exchange is the exchange. So there are, I don't know, Ben, how many? 13 maybe? State exchanges. So when the ACA was first started, of course, the federal hub is healthcare.gov. And several states actually implemented their own exchange. So Maryland, since the beginning, has had its own exchange. If you go to healthcare.gov and you say you're in Maryland, it'll bounce you to Maryland Health Connection. But the exchange itself, Maryland Health Benefit Exchange, is the main source where, the system, the relationship with the carriers, the relationship with the Maryland Insurance Administration, relationship with the legislatures, the board, and the governor, all of that happens through the main exchange. The program is Maryland Health Connection. So the way people get enrolled is to go to marylandhealthconnection.gov, and that would explain the difference. Virginia is, for example, healthcare.gov. So they're still under the federal hub. And, as a partner, we work closely with Virginia, but they are in healthcare.gov.
Okay, wonderful. So you mentioned briefly the Affordable Care Act, ACA, has been around for quite a while now. In fact, this is the 8th year for open enrollment period. How has Prince George's County been impacted by the ACA?
Now, you want to take a little bit of that, Ben, and then I'll just back you up.
Yeah, so the biggest impact has been that the number of uninsured people in the county has dropped dramatically since before the ACA. It was at about 140,000 residents of the county were uninsured. And that's now down to about 90,000. So really big drop. And most of that's either through the two ways that the ACA expanded coverage was, first, that it expanded eligibility for Medicaid, that it used to be really, really difficult to be able to qualify for Medicaid, especially if you were an adult with no children. You had to kind of go, it was really strict criteria. And so the ACA raised the income level and simplified it, making it pretty straightforward to be eligible for Medicaid if you go through a period where your income's low and you don't get any offer of coverage through anywhere else. And then so that accounts for about 225,000 people in Prince George's County right now who are covered by Medicaid. And that's gone way up since the Medicaid has been expanded back in 2013 when the official expansion started. And then the other is the subsidized health insurance plans, what people kind of just describe it as Obamacare or the ACA plans, that these are the private plans that are subsidized through the federal government. So you're not paying the full price that you would if you just showed up off the street trying to pay for it. You're paying something more like based on your income, you'll pay a portion of the actual premium costs, and the government covers the rest of it. And so those are the subsidized qualified health plans. So there's about 25,000 people in Prince George's County who are covered by that. And so both of those, that accounts for most of the decline in the uninsured in the county. And so also besides just the raw number of decreased uninsured, also the other ways that the ACA has just had a meaningful impact on people is that, there is a way to get coverage outside of your work now. And so for people who might have felt like they were locked into a job that they didn't like because, they had not even good benefits, but any benefits. Now there is this more of a safety net that that there's a system in place where they're not going to say, oh, you have asthma, that's a pre-existing condition. That's gone. That used to be a regular thing that insurance companies would do. And now we don't have to think about that anymore. You don't have to worry about pre-existing conditions when you're shopping for health insurance. So that's just a really big change in how we interact with the health insurance market. That's a big improvement. And there's still a lot of folks out there who need to kind of get out there and get whatever help they need to take advantage of it.
The other thing I might want to say too about expanded Medicaid, there used to be this terrible stigma about Medicaid. It was like free help, like people didn't want the government, to help them. And a lot of people who were struggling financially opted not to try to get Medicaid because there was this stigma attached to it. But with expanded Medicaid, because it's income-based, there are working families that have been eligible for Medicaid just based on the fact that they have low-wage income and maybe, 3 or 4 kids. So a family of 5, with a lower income could be eligible for Medicaid, and all of the healthcare costs for the adults and the children in that household are covered by the state. And that's been a great opportunity for families because it helps them leverage their resources and not have to pay a lot of out-of-pocket expenses for health coverage, and it allows them to, be able to buy groceries. I mean, bottom line, this is an expensive region to live in. And so anytime you can offset your costs. The other thing is that there's evidence that 9 out of 10 Marylanders who actually enroll in Maryland Health Connection are able to achieve savings through either cost sharing reductions or advanced premium tax credits. And those tax credits actually give a person an opportunity to say their premium might have been $600 a month for a family of 5. And with the tax credits based on the formula and the income, they may pay $400 a month. So there are opportunities for savings if people really shop and pay attention to what their needs are, what their income is. They really can achieve some savings by coming into the exchange.
And right now, that's a good highlight. Any dollar you could save right now is wonderful.
Hello.
So just kind of talking about Prince George's County partnership. I mean, it is a model that's pretty unique to the state. How did that come about?
Partnership in one respect, just working with the state or working with the community?
Both.
Well, I mean, when we first started enrolling in this program, we knew that the best voices were the trusted voices in the community. So we partnered with a lot of organizations that already had the trust of the communities that they serve. So reaching out to organizations that serve the LGBTQ community, reaching out to organizations that serve different cultural members of the community, people that had language access issues, whether it was the Vietnamese, the Korean community, whatever. When we started this program out, it was real important that we made sure that we did education and outreach to organizations who the community already trusted. We weren't trying to come out and be the government says you should, or the government, we really wanted to create a community-centered partnership to serve the residents of Prince George's County. And some of what we did in the beginning was a little unprecedented because there weren't a lot of health-related organizations that actually talked to one another because they were so busy working with who they were serving at the time. So it gave an opportunity for a lot of cross-fertilization. A lot of partners began working together on doing outreach. Also, your typical health fairs and those kind of things, when we were able to be in front of one another, those partnerships gave us a chance to be able to touch people. And I think that's why we were able to reduce the number of uninsured in the first couple of years so rapidly, because the Department of Social Services is the agency where Prince George's County Health Connect is. And because we see health insurance as one of the social determinants of health, it was important that the agency who addresses a lot of the social determinants of health be the hub where this program would live. So I mean, I think that's a great partnership story in and of itself, is that we had the good sense to know that we didn't have all the answers and we needed to work with the community to determine what their needs were, how they needed to get information, in what languages they needed flyers developed so that they could do outreach on behalf of the residents. So it's really all about partnerships and making connections. I mean, people need to have information from their trusted sources. We also did an amazing job in the faith community, because there are just a lot of churches, synagogues, and temples, and Prince George's County is just loaded with a lot of large faith-based institutions. And so we worked a lot with doing outreach and creating partnerships with those voices. Not only are they trusted voices, a lot of them have health ministries, and a lot of them really want to work on improving the health status of their congregations and of the people that they serve. And so those relationships were important to us as well. And one of our biggest partners and most comprehensive partners has been the Prince George's Memorial Library System. And I'm not just, throwing out a shameless plug. I mean, the libraries have been a partner with us from the very beginning, even let us host some of our learning collaborative meetings on site at the libraries. But librarians are, the first stop for people to get information. And so having an opportunity to make sure all our flyers are available and to work with the library system to create an opportunity for people to be able to use the computer, to go online to do their health insurance was really great. I mean, they gave us breaks on, people uploading documents. And so the library has been a wonderful partner for us.
And you kind of answer a question I was going to ask, is how can the libraries continue to help you with the residents? Now that we're in a place of being virtual, is there any other opportunities you can think of right now?
Well, yeah, because we have a lot of resources online.
Okay.
And so, just being able to point to the Maryland Health Connection website and looking at the fact sheets when people come in and have questions about Medicaid or you can just go to the websites and go to the various links to be able to get resources. And, librarians have also helped us with events, to be able to promote events. So I think the library is going to be a continuing partner with regard to education. The other thing that the libraries do that's helpful to us, because you do a lot of data and you look at poverty levels in the county, you look at education levels, you look at the situations that occur. What we found is a lot of the pockets of poverty and a lot of the places where you're doing education outreach to try to improve education, those are the same pockets where we've identified the uninsured. And so a lot of times education and the lack of resources is connected to whether or not people are accessing all the services that they're entitled to connect to.
Okay, wonderful. So enrollment in Maryland is through the Maryland Health Connection, as you mentioned earlier. Can you tell us about how the enrollment process and Prince George's County Health Connect's role?
Did you understand that question, Ben?
Yeah, so the Prince George's County Health Connect provides help to people so they're used to be in person, now telephonic or online assistance from navigators who have spent years now living in this enrollment process to help people walk through the steps of filling out the application, figuring out how to upload the verifying documents that they need. So you have to submit information about your family size, income, your employment, any employment insurance that might be offered to anybody in your family, even if it's unaffordable, just put all the information in there, and then submitting all of that, and then getting information about the available plans and helping the people applying figure out what those plans mean. What does it mean that there's a $4,000 out-of-pocket limit and a $2,000 deductible? Is that good or bad? What does that mean for me? How does that work? And so the navigators can help explain some of that vocabulary, provide the education, and if the the applicant really needs help figuring it out, they can then link them with a broker who can go through the real details of the different kinds of plans that are available. So a lot of the navigator's job is to help people submit those applications, deal with any technical issues, understand all of the information that is being asked of them, and understand what information is then coming back to them. And then doing that in, how many languages are we doing that in now, Sherry?
Well, I mean, the language line has 120 languages.
Yeah.
Our immediate force, we have bilingual navigators, Portuguese, Spanish, Arabic, French, so we do speak directly to the consumers in language. And then if they have a language that we don't have available, there's a language line that we have access to immediately that can help us with the translations. The other cool thing about enrollment is there's an app, a mobile app, and a lot of people don't know about the mobile app yet, but you can go to the Apple Center or Google Play and download the MHC app, which Nicholas is showing now. And because we're virtual now, it has been a wonderful tool for people to be able to upload documents and to be able to continue and complete their application process, because the app is like right there. And, particularly younger people who really need to hear this message because they need to make sure that they're covered. This is a device that they're comfortable using. So right from your phone, you can make all this happen without even talking to us. So everything has gotten so much better in terms of the system working. The Maryland Health Connection works diligently on trying to improve all the time, easier access to how to complete the application. There's a lot of detail that's required. This is not easy for people who have limited English proficiency or people who are PhDs in 5 different disciplines. It is so complicated to figure out what you need, what your family needs, what the budget will give you, how much you need to spend, how much will you pay, where do you find your doctor, how can you get the doctor, if you change plans, how do you get to keep your doctors? All of these questions can be answered by our navigators. And so it's important for people to browse. And even if you have insurance like from last year, before you completely renew, you need to come in and see if you can achieve some savings, if there's other benefits that you can get based on the carrier you select. There's 3 carriers in Prince George's County under the exchange. Okay. One is Care First. The other is Kaiser, and the third is United Healthcare. So those are the 3 carriers that people can select to provide their coverage and their premiums. And the exchange has done some interesting things in terms of value plans and figuring out the different levels. So the carriers have really worked hard with Maryland to come up with affordable ways for people to figure out how to select their plan.
And since we're talking about enrollment, I think I saw when we were moving through the pages, what's the enrollment period right now?
December 15th is the deadline for open enrollment, and that's for private coverage for 2021.
Okay.
So if you want coverage to start January 2021, you need to get in before December 15th and make sure that you choose your plan. Medicaid is year-round, and so there is no deadline for enrolling in Medicaid. It's a year-round program, and so is the Maryland Children's Health Program, more colloquial called MCHIP, and that program is year-round too, and that's for kids.
Okay. Speaking of this,
if you really definitely do want to try to hit that deadline for the 15th, if you don't have coverage now, or you know that you're not going to have it in January, but if you miss it, and it's not game over, you should still call up and figure out if there's some way to enroll outside of the open enrollment period. There's a lot of exceptions now because of COVID, and like Sherry was saying, there are a lot of programs that do have year-round open enrollment. So to be safe, get in before the 15th. You know, there's going to be a line on the 15th. It's always backs up the last day. So, you know, call in now, go to the website, call in if you don't have coverage to try to get in.
And we're open Saturday. So, you know, the flyer, if you go to our website and look at the flyer, you can see when the times. We're open in the evenings, Wednesdays and Thursday evenings until 7:30, and we're open on Saturday. And we have 4 numbers that you can call. So we have a very comprehensive program, and we're just trying to make sure that everybody who needs health insurance or information about health insurance calls us.
Yep, you've definitely provided quite a few avenues between phone, weekend hours, and the apps. You know, definitely. Talking about enrollment, Maryland is doing a wonderful job with enrollments. I understand that enrollment by young adults is continuing to increase, which is good. Yet there are still a number of uninsured. Who are they, and what do they look like in Prince George's County? And what are the challenges that are having them not follow up?
So yeah, I think that the 2 biggest challenges for the remaining uninsured in Prince George's, so there's about 90,000 people left in the county, just probably ticked up a bit since COVID, just because of, you know, what a crisis, what an apocalypse it is. But so there are a lot of uninsured people, and so the first big challenge is that most people who are not insured don't know that they're eligible for any of these programs. They assume that they're not eligible for the people that are still out there who haven't signed up. It's not like they came in and checked and they didn't like the programs. They just assumed, oh, it's not for me. I don't qualify. I'm not for that program. And so we really want to hammer home with people. You should go check, call in, use the app, go to the website. If you don't have coverage, if you know somebody who doesn't have coverage, everyone has a friend or a family member who is uninsured. Go and check with them, give them a little nag, and try to get them to go check to see if they are eligible. There might be a program that will cover some of their costs or all of their costs for health coverage. And right now it's really important to get covered. So that's kind of the challenge number 1. And then the second challenge is that that the immigration status can make it really complicated for signing up for these programs. So most people with any kind of lawful status, where a status where you can get a work authorization with it. So that includes people with things like temporary protected status, people with green cards who just got them, people with other kinds of just temporary statuses. They do qualify for the subsidized health coverage programs. And children in those populations do qualify for full Medicaid or the M-CHIP program for kids and pregnant women. So we really, and that's another thing, people don't know that they qualify, and it can be hard to get through that application when they're asking lots of complicated questions about immigration status, and it's all, and you maybe are not fluent in English or at least not written English, and so working through all of that can be a real challenge for folks. And so that is another area where the Prince George's Health Connect has a really great team of bilingual navigators and a language line for anyone outside of those languages to help people get through that. Sherry,
and asking questions is free.
Yeah, that's true. Yeah.
So, you know, just call us and ask. I mean, you know, a lot of people, like Ben said, just really don't know. And when we work in the community and go to health fairs, you can't believe the number of people that say, but I didn't think that was for me. You know, there's artists and musicians and a lot of people that work in the, you know, gig economy that think because they don't have a job or they haven't had a steady income in the last couple of years that they're not eligible to apply, and they are. We did some work in the Mount Rainier area and was doing some outreach with some of the artists in the community, and you know, the shock and awe that they could actually apply for health insurance was amazing. And you know, sometimes we get follow-up from some of those people who, you know, got health insurance like for the first time in 10 years and, you know, are on the road to improving their health outcomes, because that's what this is really all about. You know, I can't say enough about the importance of having coverage so that you can be on top of your own individual health. Primary care and wellness checks are so important, particularly during this time. People need to be on top of what's going on with their bodies and to know what their status is in terms of their health. you know, and all the other testing. I mean, under the Affordable Care Act, you know, mental health is an essential benefit. And so, you know, years ago, the only help you could probably get was like for a substance use disorder, maybe. And now mental health and behavioral health services are covered, and it's an essential benefit. And so, you know, during this time particularly, a lot of people are really struggling with how to cope with the whole pandemic, you know, with loss of family members, with loss of jobs. And, you know, with health coverage, you can actually seek out help to cope with what we're all going through. It's just so important, you know, to not only have the card, but to use it.
I'm actually pretty happy you touched on the mental health piece as well, because I think people think when they think health, just body, physical, not mental. So that was pretty good highlight to touch on. What additional resources are available for consumers to the public to learn and understand more about health insurance? You highlighted how important it is, but what other options are out there or resources?
Well, I think, you know, you start with us, you know, trying to get covered. A lot of the managed care organizations, a lot of the health centers, the hospitals have amazing outreach programs. You know, communications around health has improved exponentially since COVID. I mean, if there's any bright side to what we're going through in the pandemic, is that public health has now been elevated to a place where everybody's talking about it. And a lot of institutions and organizations never thought of themselves as being connected to health until this crisis occurred. And so there are more and more resources being developed over time. So people need to just stay in touch. I mean, in Prince George's County, you can even get information from 311. I mean, you know, all of these programs and everything is driven to that. Just going to your library. I mean, the better thing that we can do is to make sure that the libraries have access to all of our information and resources and programs within the Department of Social Services and also under Prince George's County Health Connect, because knowledge is power. I mean, you know, you don't know what you don't know. And so what we're trying to do is make sure that everybody understands there are places that you can call. There's people, real people on the other end of the phone that you can talk to, that can offer you resources and guidance as to how you can manage and navigate through the healthcare system.
Ben, do you want to add anything before I move on to that? Okay. You all have definitely highlighted on the importance of having coverage, how to get coverage, all the resources, all the numbers and the websites. And so we do have some questions from the audience, and I do invite the audience to share their questions in the chat. I think Nick was going to go ahead and push them forward to me. Are any of the providers covered under Maryland Health Connection participating in virtual and telemedicine during COVID?
Yes. Well, first we need to understand that Maryland Health Connection is just the access point to get you coverage, to connect you to the healthcare organizations. But I do know
you'll actually be covered by Care First or Kaiser or whatever the Medicaid provider is. You would be covered by Maryland Health Connection. Yeah.
So a lot of the providers are offering this, particularly since some of the laws have changed and it allows them to bill for a telemedicine time. You know, at one point when telemedicine first came out, a lot of people weren't able to bill and get reimbursed for that time. But, you know, that has changed in terms of how that works. And it is safer, you know, to, unless you have to be touched, like your tooth fell out and you have to go to the dentist. But, you know, if it doesn't require, you know, them to physically touch you, you know, there are opportunities for that. So yes, I would say the answer is yes.
What does it mean when elected officials talk about the individual mandate with regards to ACA?
You want that, Ben?
So,
it's gone.
Yeah, I'll dive in. Yeah, the individual mandate was the penalty that you would have to pay if you did not have health insurance at all. so that it was to require people to find a way to buy health insurance. If you didn't get through your work and you weren't very low income, then you would have to pay a fee if you did not get insurance through the program. And so the idea of this was to make sure people didn't just wait until you're sick and then get the insurance, especially younger, healthier people who they really want to participate and keep in the pool. And so it was to kind of nudge people in to go and make sure that you get insurance and don't just sit it out and bet that you'll be fine. And so this is now, the individual mandate has been reduced to not existing anymore. And so it might come back in the next administration. We don't know yet. Right now, I don't think anyone needs a motivation of a few bucks to go out and get health insurance. I think that most people, if there is a way to get your health insurance and it's affordable, you should go out and do it. And right now is a time where that should be really, really clear for folks. Yeah.
So in other words, proactive versus reactive.
Yeah.
And you won't be penalized if you don't have it monetarily, but the penalty physically for not having access to health coverage is a big deal.
Do we need health insurance in order to access COVID-19 testing and a vaccine when it comes out?
You don't need health insurance to get a test because a lot of the testing programs are open to anybody. The challenge is if you have a diagnosis and you need treatment, you will need health coverage in order to see a doctor to be treated. And so that's why we emphasize and urge that everybody have coverage because, God forbid you test positive and you need continuing health care, you're going to need to have access to health coverage in order to make sure that you can improve and get better. The vaccine, I think initially with the vaccine, they're going to do a mad inoculation of everybody that they can. In Prince George's County, they would really love to get 65% or more people vaccinated within the next year. And, the health officer is working really hard on making sure people are educated and understand the stigma around vaccinations and the importance of being vaccinated. You will not have to have health insurance in order to get the vaccine, particularly in the first couple of rounds. But we kind of don't want to talk about not having health insurance. we kind of don't want to give people any idea that not having health insurance is okay, because it's really not okay.
Okay. Does Maryland Health Connection offer virtual assistance when renewing medical coverage?
Yes, it does. When you call our hotline numbers and talk to a navigator, they can give you that option to do a virtual visit. In fact, we encourage it. If the consumer wishes to do it that way, we can help you do it that way. All of our people have been trained on how to protect your privacy and your information. And if somebody wants to do it virtually, we have the capacity to do that. And sometimes it's really important. It can even go faster sometimes if you're looking at somebody rather than doing it over the phone and they can't see you. So the answer is yes.
What options are there for getting non-emergency care if individuals are not citizens?
Well, one of the wonderful things we have in Prince George's County is 6 federally qualified health centers. So the clinics, Mary Center, La Clínica de Pueblo, Elaine Ellis, Greater Baden. Who am I leaving out, Ben?
I should know that off the top of my head.
Yeah. Anyway, we have health centers.
Oh, CCI,
Yeah.
Community Clinic.
Yeah. Oh my God, don't get me in trouble. And CCI. So fairly qualified health centers are actually designed as a safety net clinics for people who otherwise don't have health insurance. I mean, they serve people that do have health insurance, but they can also serve you for a fee schedule. In other words, they do not turn people away regardless of their ability to pay. That's their model, and that's the safety net design. People who have an income and are not citizens can still purchase insurance from the carriers. They just can't do it through the exchange. So there's a list of brokers on our website. We have some brokers, and there are ways that people can get covered through Care First, through a Kaiser, and purchase it on their own through an insurance agent. But it just can't be on the exchange through Maryland Health Connection. But there are several ways that people who are non-citizens can still get coverage and see a primary care provider and handle their wellness care through our clinics and centers without worrying about whether or not they're eligible on the exchange.
Yeah, and just to nitpick a little bit on the word non-citizen, so the vast majority of non-citizens have some other kind of status and are eligible for subsidized health insurance. So they are not ineligible just because they are non-citizens. Really, when we're talking about people who are ineligible for any kind of coverage, it's just folks that have no documentation, or all their documentations are out of date, expired, and then people who are here under the DACA program, the Deferred Action for Childhood Arrivals, or DREAMers, which was put in right at the end of, or I guess in the middle of the Obama administration, and was cut out of the Affordable Care Act. So really that's just those groups are ineligible for coverage, but most people who are non-citizens either have a green card and haven't turned it into citizenship, or have a temporary protected status or work authorization and are here temporarily legal. They just have not, they either can't or have not yet converted fully into being U.S. citizens, but they still do qualify. So if you, and if there is a member of your family or your household that is an unauthorized immigrant, their papers are out of date, they don't have any papers, your household still is eligible to go in and apply for coverage for everybody in that house that might qualify for full subsidized coverage. So we see this a lot with mixed status families, where one parent has a status, one parent does not, and the kids were born here in the U.S. And that family has lots of hours with immigration lawyers working through that system to try to get everybody straight and move forward. But they can still go in and get full coverage for those kids who are born U.S. citizens. They can still get full coverage for the parent who has a lawful status and a work authorization, and there's no penalties, and there's no documentation, and we don't share any of that information about people's status outside of just verifying your eligibility. So just wanted to clarify that real quick when we're hitting on the non-citizen piece.
Because it is a safe place to inquire.
Yeah.
Is it true that health insurance premiums are higher through the exchange compared to other avenues for getting insurance?
No.
So, yeah.
Not necessarily. That's why we emphasize the shopping part, because there's so many plans and so many different levels. So you may opt to have a lower cost premium, but maybe a higher deductible. If you're somebody who doesn't get sick that often and doesn't have a lot of needs, you might want to reduce your premium cost by having a higher deductible. But they're promoting, and we believe that if you are eligible for insurance on the exchange, it is more likely that you will have savings versus if you try to purchase insurance on your own. And it also may not be the quality that you want. Like some people just purchase catastrophic coverage, just for hospitalization, but it doesn't cover anything for primary care. So they may think that they're saving money, but at the end of the day, if they have to use the doctors 4 or 5 times a year, they're going to end up spending more money than they would if they had gotten insurance.
Mm-hmm.
Ben, did you want to add to that?
Yeah, I guess just that, when most people experience health insurance premiums, it's usually because it's coming through your employer. And so that is actually something that's just worked out in advance where the employer is paying a big chunk of that premium. It's one of the good things about having a job with benefits is that they've already negotiated it out and they're paying most of that premium. And so it's a big shock when you're outside of that and you have to pay the whole price just straight up front. And so that if you're trying to do that without a program like the ACA subsidizing some of those costs for you, it's going to get really expensive really fast. And so if you qualify for those subsidies, it's going to bring it down. It's going to feel more expensive than it is if you're getting it through your employer because they're paying a bigger share normally. But if you don't get your coverage through your employer, then there's not a cheaper way to get comprehensive health coverage than through the Affordable Care Act.
Well, wonderful. This has been a wonderful conversation. I believe we don't have any more questions, but the information you all have shared has been wonderful. So I'm going to kick it over to Nick to close us out.
Well, thank you so much, Sherry and Ben and Aishar. This was a really wonderful conversation, and it's an important one that we have to keep having on a very regular basis in hopes of reaching more folks. For folks who are tuning in who might be new to this healthcare conversation, especially if you're a new adult, for example, if you've just recently turned 18 or you're just living on your own, please get coverage because you never know what's going to happen, especially right now in the middle of a pandemic. Getting covered is extremely important. And with that, there's the caveat that for situations like getting that COVID testing, it's available for free through both the county and the state. And also is covered through the government if you need to go to another place like CVS or such. So please visit PGC Health Connect's website for all the information. Note that you've only got 5 days left for this open enrollment period. And Sherry and Ben, when would be the next open enrollment period, or what are some qualifying events in case people need to kind of get covered out of these periods?
Well, Medicaid is year round, and there are opportunities for special enrollment if you have a qualifying life event. So you have a baby, or you get divorced, or you get married, or you lose your job. Those kinds of events will allow you to come in because you've had a change to come in and apply for health insurance. Before open enrollment, there was a special enrollment period specifically for COVID. We don't have information on whether or not that's going to be reinstated after the first of the year. But we always encourage people to try because based on your income level and Medicaid is year round, you could very possibly be eligible for Medicaid and not have to pay out of pocket for insurance. So we never want people to stop asking. I think that's what the message is. If you are not insured, you need to call us to find out what you're eligible for and what the cost may or may not be. You can make an informed decision on whether or not you're going to opt in or opt out. But if you don't know, then you can't make that informed decision.
You're muted, Nick.
I finally caught me. First time all week that I did that. Thank you all so much for your expertise, and thank you, Aishar, for facilitating the conversation. We'll be back again next Thursday for our English program. We'll be focusing on domestic violence awareness next week. And on Tuesdays, we, of course, continue with Café a las Cuatro. Tonight, we have an awesome author event featuring author Jennifer De Leon, who will be discussing her new book, Don't Ask Me Where I'm From, which is about a young Latinx woman who kind of deals with racism and finds her way in coming of age. So we encourage you to tune into that at 7:00 p.m. and stay safe, get covered, right, by December 15th if you're not. If you have any questions whatsoever, contact PGC Health Connect. You can reach them on social media, call their call center, or you can always call the library at 240-455-5451 in English or Spanish, and we will connect you to the resources and connect you with these great colleagues that are working with us here.
And please let us know if there's anything you need or if there's any specific information that the library would, finds as a deficit. Just let us know and we'll make sure we get you whatever you need so that you can share it with the residents.
Awesome. Well, thank you so much. We appreciate it. And we're going to have we're going to play one of the PGC Health Connect PSA videos on the way out here so that you can get a little more flavor here. And we hope you all stay safe this holiday season. Appreciate it, everyone.
Get
Bye-bye.
covered,
Thank
get
you.
seen, get healthy.
Sounds good. Bye-bye.
Bye-bye.
Don't take the chance. It can happen to you.
事故也可能发生在你的身上。
Le puede suceder a usted.
Ça peut vous arriver.
申请保险，
Obtenga seguro médico.
Cherchez une couverture médicale.
拜访医生，
Programen visitas para ver sus doctores primarios.
变得更健康。
Mantengan su salud.
Restez en bonne santé.